Dear colleagues, I'm glad to introduce you our poster presentation about Chêneau brace treatment possibilities in patients with progressive idiopathic scoliosis spine deformities. The generally accepted indications for the brace treatment for scoliosis are deformities in growing patients over 20 degrees by cup. However, patients with progressive deformities over 40 degrees by cup are implicated in brace treatment because of controversial growing spine surgery data. The objective of the study was to evaluate Chêneau brace treatment effectiveness in growing patients with initial idiopathic scoliosis surgical spine deformities. Prospective, comparative, consistent study was performed in the Russian Republic Scientific Practical Center of Traumatology and Orthopedics. We have no conflicts of interest to disclosure. This study enrolled 283 growing patients with IS surgical deformities. Thoracic deformity type was in 122, thoracolumbar in 79, combined in 82. Initial value of pathological arcs was from 41 to 135 degrees by cup. Brace treatment was studied at the age of 5 till 16 years. All patients had active spine bone growth. Duration of brace treatment was from 3 to 7 years. In 157 patients with initial arcs of 41 to 71 degrees under brace mode, the bone growth completion was obtained stable spine deformity correction, which didn't require surgical treatment, since the value of the arcs doesn't exceed 4 degrees and the spine had sustained frontal and sagittal balance. This is the clinical example, and the before treatment we can see here, and 3 years after treatment clinical result and radiological result also. In the remaining 126 cases, the brace therapy allowed to restrain deformity process in the patient's general physiological development and perform scheduled surgical treatment stage in the most favorable period of spine bone growth completion. These patients were successfully operated at the age of 16 to 20 years. The analysis showed that the Chêneau brace treatment is an effective method of treatment for idiopathic scoliosis in growing patients with initially surgical spinal deformities. It allowed to avoid surgery in 56 percentage cases when deformity regress achieved non-surgery parameters. Thank you.